Dr. Pam Kryskow is a medical doctor, a researcher, and medical advisor. She's currently the medical lead of the non-profit Roots to Thrive Psychedelic-Assisted Therapy program, which treats a wide range of conditions. She's also a founding board member of the Psychedelic Association of Canada and medical chair at the Vancouver Island University Postgraduate Certificate in Psychedelic-Assisted Medicine-Assisted Therapy. Please welcome to the stage Dr. Pam Kryskow.
Thank you, Dominic. Oh, feeling a bit nervous, so I'm just going to take a big breath here. It's wonderful to be here. Thank you so much for inviting me. My first time to enjoy Iceland, and it's been absolutely phenomenal so far. So here are all my disclosures. So I work for 2 universities. As mentioned, I'm the medical chair of the Vancouver Island Postgraduate Certificate in Psychedelic-Assisted Therapy. I also am the medical lead for Roots to Thrive, which we'll talk about, and I do some advising work. And so this is not new, really. It's new-ish, right? Frontiers in mental health. These medicines, which we've already talked about today and many more to come yet, dozens of medicines we could be talking about when we talk about psychedelic therapy. The ones I've listed here, psilocybin, MDMA, LSD, 5-MeO-DMT, which we just heard about, ibogaine, ketamine, ayahuasca, wachuma, 3-MMC, we could go on and on and on. There's so many medicines. And so when I thought about how I was going to do this talk, I was thinking, like, I have 30 minutes. I've never done psychedelic therapy in 30 minutes. We have a whole year that we talk about this with our students. And we tell our students over and over and over in the program that it really should be a 21-year program. And so here we go in 30 minutes. We know these medicines are helpful for what we label as more like symptom constellations that manifest as post-traumatic stress disorder, depression, anxiety, substance use, disordered eating, end-of-life distress, and many, many more challenges that people are dealing with in their mental health. And there's so many diverse ways of approaching them with therapy, with the difference of the medicines, the difference of the symptoms, that it would be really impossible to ever say there is a way to do this work. And so I'm not going to go into any detail on how psychedelics work because others are going to be covering this in much more detail just before, but we know some of them hit our serotonin receptors. Oops. Sorry about the formatting on that. We know that they promote neuroplasticity, which allows us to make new neural connections, which allow us to have new behaviors. And we know that they help us with cognitive shifts. So we can have these emotional breakthroughs, we can have new perspectives that then allow us and our patients to have new ways of being in their life and moving forward. And the impact of these altered states in the psychedelic realm is that our patients can get more deep inside of them to go, what is going on? How can I look at things differently? How can I see things differently? How can I engage with my inner healing abilities? And these facilitate breakthroughs in their therapeutic sessions. We definitely see positive personality shifts immediately, like coming right out of a session. We see people already noticing differences, feeling happier. Am I really happier already? Possibly. And then, of course, in the hours, days, weeks, months, years, even on. And obviously, trauma processing. We know that there's parts of the brain that then reduce their activity as a result of psychedelic therapy, and there's other parts that upregulate and gives us the ability to get out of the fight, flight, flee, freeze areas when we're dealing with trauma, and then move into an ability to actually process it and move on. And of course, it facilitates insights. And there's a bit of conversation now, especially in with the clinical trials and moving forward as these medicines are coming back, is it the psychedelics, is it the therapy? And of course, anyone that has worked with these knows that it's both. So it can be that it's the therapy that is assisting the psychedelics. Of course, really solid therapy, a good therapeutic alliance, a good relationship, good processing, setting up, getting ready for a psychedelic session, all of that matters. And then that can enhance the psychedelic session, and all of that therapeutic work after will enhance. but it's also the psychedelics assisting therapy. Many people that come to psychedelic therapy have been in therapy for a very, very long time. And in the matter of a session or 2 sessions or 3 sessions, come to enormous insights that they have never been able to obtain. And sometimes the psychedelics help them break through a wall to get to the other side. Often we have the image of you're just trying to get over there. If you could just get over there, and the psychedelics allow people to go through and beyond. And so it's really the circle of psychedelics can help therapy, therapy is helping psychedelics, and it really is a circle all around. And there's so many therapeutic formats. And so we've got the one-on-one, so we've got one-on-one and dyad therapies. We see a lot of that in our clinical trials. We see a lot of that portrayed in the media, and also in the therapeutic community. We know we work with our counselors, you work with your therapist, you're used to the one-on-one. And in the psychedelic sessions, you see with psilocybin-assisted therapy, or in the MDMA therapy trials, you see the dyad modality. And there's also couples therapy. We're seeing an emerging work with couples with psychedelics. So that's a modality that people are already used to doing that in therapeutic alliance and in a therapeutic relationship. But now you can add in low-dose psychedelics like low-dose ketamine and really help people move through in that couples therapy. We see a lot of family therapy work emerging, especially around MDMA, with MDMA, really helping families be able to lean in to the conflict of their family, and even in some cases working back and dealing with intergenerational trauma and even epigenetic trauma, what they brought forward. And then group, which is really where my heart lies and my bias is in the group process. Just we're collective beings. We are meant to be. We are social. We are meant to be with each other. You know, historically, we would have been in our communities for very long times. We would have healed in our communities. We'd know the medicine people in our communities, and that ability to be in a group setting and a group healing is just. I think it just takes it really to a higher level. And so there's so many modalities that work with psychedelics. I'm only going to go through a few, so apologies if I offend you by talking about your favorite, but there's just so many. Like, there's art therapies, there's so many somatic therapies, there's sound therapies, there's haptics and you know, body movement therapies. You know, most therapists start kind of somewhere in the cognitive ones, and cognitive behavioral therapy is one that is taught very early to medical trainees and to therapists, and works very well for helping people, you know, and cognitively make those shifts. Acceptance and commitment therapy is one also that is nice and is easy for therapeutic teams to start to learn and start bringing in if they're not familiar with it. And we're seeing ACT used a lot in actually some psilocybin therapy, or psilocybin clinical trials right now. In fact, I'm involved with 2 that ACT will be the primary therapy in that trial. And psycholytic therapy, I put this in here because I want people to think more about this, because it is a really solid one. If you have a good talk therapy alliance with somebody, bringing in something like low-dose ketamine can really open up that therapeutic process and really move people along. It can be very heart-opening, almost very similar to the dips and valleys when you're working with MDMA, that when the person can come in to talk and start processing. We see some really sweet work that can happen with low-dose ketamine. There's, of course, the transpersonal psychology methodologies that work very well as psychedelics. And internal family systems has found a really good home in psychedelic therapy, and we find a lot of our therapists are working with that. And a somatic one, the psychedelic somatic interactional psychotherapy, really interesting work. If you haven't seen this, there's a lot of podcasts out there now where you can actually go along and see how this therapy works. And a good number of our therapists on our team are actually working through this, and I have to admit, they're all really blown away on what it's bringing up for them and what it's helping them move through their own personal process, so they're even more foundationally strong as they offer therapy to our patients. And then there's resiliency-focused therapies that really help people build their resilience and really increase their happiness with their life. So stepping over to, I want to go back to the different doses too, because we think about, mostly when we talk about psychedelic therapy, we're often really thinking about these really deep sessions where you're in more the heroic dosing of the medicines. And I want to bring back into, again, and say it again to be redundant, is that the lytic dosing can be really, really powerful. It is, we've had, for instance, one gentleman our team worked with, went really well through a whole series of ketamine journeys, 3 ketamine journeys, then went through 3 psilocybin journeys. And it was the 6th session that was actually low-dose ketamine that he was like, this was the one I needed. This was the breakthrough I needed. And so it can certainly be part of a toolbox having both the deep sessions and the light talking therapy. So in practice, we talked about the dyad model. We see that in the MAPS MDMA therapy. And of course, there's other therapies used with MDMA and in the MAPS model. But using supportive non-directive therapy, really engaging the client or the patient's inner healing intelligence. This one I bring up because a lot of people haven't thought about this, but there's a lot of therapists out there that do different modalities of couples therapy, such as imago therapy. And again, what we're seeing with this is that using a low-dose medicine allows couples to engage even more deeply with that process and move them along at a speed that it just accelerates that couples therapy where they can really get back to their heart center and really engage and go through the process that they need to create a strong partnership. Family-based therapies, again, MDMA, low-dose ketamine can be very helpful here. I should disclose, too, that where I work in Canada, we do get special exemptions, so we can work with these medicines legally. We're working with MDMA legally, we're working with psilocybin legally, and of course, ketamine's a legal medicine, so we're working with that. But we're seeing, especially with families that have these intergenerational traumas, we work a lot in First Nations communities and in Indigenous communities, and with the history of Canada's colonization, there's a lot of trauma that has been going over generations, and we can see families coming together and on these medicines really being able not only to lean in and deal with their own personal trauma and where they're at, but then going back and helping heal some of the stuff that's been handed on to them so that they never pass that on to their descendants. And then it's a psychedelic journey, obviously, the deep, high level, or high dose, not high level, high doses of psychedelics to go into that inner journey. One of our Blackfeet elders talks about that the journey is always in and down, and the psychedelic dosing allows that. And I think before we move on to more of the Roots to Thrive model, it's so important to talk about the importance of therapeutic competence. There are so many people that tripped last week and now they want to be a therapist. We see this, like, just stop. It is, we have such the honor in Roots to Thrive of working with so many Indigenous wisdom holders and elders, and being in right relationship with whatever medicine you're working with, like really understanding the medicine, the spirit of the medicine, and how the medicine wants to serve is important. And part of that importance is understanding how the safety of working with that medicine. So working with, like, is it safe for this person? Does it interact with anything they're already on, any vitamins, herbs, minerals, medications? Really understanding that medical safety, really making sure you understand the psychological safety, because we are in a do no harm situation. We never want to bring harm to anyone we're working with. Competency and in your skills. Our elders, that work with medicine have been working for decades with medicine. We in the Western world think, especially in medical education, many of you will have heard, see one, do one, teach one. That can't work for this. It takes decades to really, really learn, even who you are, so that you're foundationally strong to hold a solid healing container for who you're working with. And so we highly advocate for being skilled, lifelong learning, being in supervision groups, being in accountability groups, having much wiser ones part of your learning circle so that you're learning from them. And as you gain your competency, then you in turn mentor others that are up and coming. And that's lifelong. That never ends. And there is no best model, really. You know, the best model, one of my wise mentors said, the best model, Pam, is the one you're really good at. So get really good and keep getting good and keep learning and keep adding to your skill set. You're always adding more to your medicine bundle. You're always adding more to your medicine basket, and that's the competency that you keep working with. So not new to you, just very quickly, you know, we know we're facing a mental health crisis. We know these levels are going up. In Canada, treatment-resistant depression is going up by 4% every year. It's going up and up. So is antidepressant use, so something's not working there. We're still going up. And I don't think I've heard it yet at this conference, and I think it's really important to note, like, we have increasing social disconnection, and we just have to say it, like, social media has not been super helpful. Like, we have seen increasingly disconnection, division, anger. I have never seen so many disordered eating challenges in youth as I've seen now. And it's coming directly from social media. And so I thought when I entered medicine that I would actually be out of business at some point. And in the last few years, I've realized we're not going to be ever out of business, which is kind of depressing because I kind of want to go on vacation soon. So community healing. So this is where it really comes back to. And how, again, like I said at the beginning, we are social creatures. We need to be with others. We need to heal in community. We need to feel love and acceptance, and that what we are doing means something, and we're doing it for our community. I think you probably understand that more than anyone here in Iceland. So I'll move into Roots to Thrive, and why I want to talk about this model is it's not the model, it's just a model, and it's a model that's in a constant quality improvement. We are always trying to be better. We are always trying to go, how can we serve our patients better? How can we, hopefully, eventually put ourselves out of business? So we do it in a nonprofit model. Our programs are for anywhere from 8 to 12 weeks. The first 4 weeks are spent in groups, learning resiliency, learning regulation techniques, leaning in, learning more about oneself while preparing people for the medicine that they will eventually be working with. Like I said earlier, in our case, it may be MDMA, it may be psilocybin, and mostly it's ketamine. They meet every week for a minimum of 2.25 hours. That's the minimum, because we have a whole bunch of other stuff that's available that allows them to meet their own personal healing needs. But they're learning mindfulness, they're learning breath techniques, they're learning to get out of their head and get back into their body so that their mind and body become reconnected. So many of us live up here, and especially our patients that are really, some of them just surviving. They're in this headspace of not belonging, I'm not good enough, I'm broken, I'm unfixable. And what we need to do is get them reconnected to their body. So we spend a lot of time in these weekly sessions helping people get reconnected to who they are. And then interspersed in the middle of that are up to 3 psychedelic sessions per 8 or 12 weeks. And then at the end of it is ongoing integration, on helping them, again, know all these tools that they have, get reconnected to their communities, reconnected to who they are, getting reconnected to nature, reconnected to art, music, all the things that really make us whole and happy. And then the other part at the end of it, and I think this is really important, we take giving a medicine very seriously. If we give somebody a psychedelic medicine, we're responsible to them forever. So we have an alumni program. So as people finish our program, they move into an alumni program that has free offerings. And they can be in there for as long as they want. So that's sessions with our psychiatrists, that's sessions with our psychologists, our therapists, our energy workers, our indigenous elders. There's mindful movement, there's yoga, whatever we can offer. We want them to know that as long as they need to keep on their healing journey, we're there for them, regardless of time. And so the flow of therapy is very similar to what you've seen. We make sure there's very good preparation, along with all the regulation techniques. There's the psychedelic sessions, and then there's ongoing integration. And so what really makes the model work, and what is for anyone who wants to adopt a model like this, is we have a really large interdisciplinary and multidisciplinary team. At the very top, there's no hierarchy, but in it, our elders. So we have indigenous elders that are in our program, that bring their wisdom into our program. We have doctors, we have nurses, we have therapists, we have energy workers, we have somatic workers, social workers, spiritual care. And the bigger the team, the better. Because we all come from different worldviews, we all come from different training, and all of that brought in service to the patients or the clients, is a much better container. It's a complete flat hierarchy, and whatever serves the needs of the patients we work with is what is brought in. The nice part of teams, too, is the safety of it. You're always watching for the red flags in your colleagues. You're making sure that they're foundationally strong, that they're healthy, and that they can take a break if their life's in a bit of a shakeup, so they can go back and get whole, get their foundation strong, and re-nourish themselves so that when they come back into the Roots to Thrive ceremony or container, that they're foundationally and healthy and strong. I have to admit, as a physician, it's probably the happiest and the healthiest I've ever been, to know that at any time I can step back and take good care of myself, and then I can come back with an incredibly strong team. So I highly advocate, if you're working in this field, create strong teams, create teams that you can learn from, who you can help learn, but that there's not this hierarchical place. We integrate two-eyed seeing, which is a concept from Albert Marshall, who's a First Nations elder in Canada, that we work better when we can use all ways of knowing. So we can integrate the Western medical model, take the best parts of it, while we integrate it and weave it together with indigenous ways of knowing. So the community, the spirit, all of that being woven in to a model where we, as healthcare providers, can again show up whole. And community-based. So we started in the hospital system. We realized that it was strangling what we could do. And so we moved ourselves out and into a nonprofit, and we work only in the community. The result of that is, as people are going through a program like this, that they're engaging at the same time with their family members, their kids, their community, their workplace, and they're bringing the learnings that they learn from the program as they go through back into their community immediately. And so the ripple effect of that is enormous. We hear people say, I'm bringing this into the boardroom. I'm bringing these regulation techniques into the boardroom. We're starting our boardroom meetings now by checking in and seeing how we are. I can't say how honored we are so much that we do get to work with First Nations and Indigenous elders in the program. You know, the cultural wisdom that they bring to us, helping us all return to being more whole humans and helping with our, moving out of this individualistic but more to this community and culture of healing. The rootedness that they have, they're just so strongly connected to their place and their land. And we need that. So much of us, because I'm coming from the Canadian perspective, we've all come from another place some generations ago. And so we don't often have that connectedness or rootedness to the land. The community healing, again, for many of us, this need for this intergenerational healing. for all of us so we can be healthier for our descendants. And really the bridge building. It's just such a nice place to be, to really bring spirit and love back into medicine. That we can weave it all together and not have to see it as one or the other or othering, that we can actually co-create a better system. The program is hybrid, and this was something I was quite critical of. I didn't think it would work, but I was completely wrong. I love when I'm wrong, and that's where I really get to learn. And what COVID was hitting after we had done our first cohort, and so we transitioned to online. And this was a fantastic learning for us, that most of the weekly sessions are online, and of course all the psychedelic sessions are in groups. As you can see there, we have 8 people journeying in each group. But the online was really interesting, that people could be at home on their couch with their cat and a cup of tea and connecting with the group. And I didn't think they would connect as much, but then when they came on site for their first psychedelic journey, our participants were hugging each other as if they had known each other forever. You know, Kamel, you're taller, you're shorter, but it was such a connection. And they had really only known each other for 8 hours. So it was a good learning, and we would hear over time, and still hear, that the family members got the benefit. They would get off their online session, and then they would bring it right back to the family and start doing it. So some of the science around our model, we published in Frontiers of Psychiatry, and these are our numbers, and they're actually getting better. So we were seeing clinical reductions in anxiety and depression, and for those that come into our program who have PTSD, 86% at the end of the 12 weeks no longer qualify for that diagnosis. We're following up on this for up to 6 months and 2 years, and we're going to be publishing on that. But the numbers stay pretty close. And when the numbers dip, we call them up and ask, and usually it's some sort of life crisis, that something's happened, and they're saying, but I'm handling it so much better than I ever would have before. So the power of healing in communities, they definitely enhance healing. So we've had opportunities to work with firefighter cohorts, police officer cohorts. We've separated by gender identity. We've had women, we've had men. Most of our groups are all mixed, actually, and right across the board we see the same outcomes. We've just finished a firefighter small little cohort trial, which just got accepted for publication. And again, the numbers are very, very similar. We're seeing the same level of clinical reductions in depression, anxiety, increase in resiliency, and resolution of PTSD. The indigenous wisdom is so important. Again, I just can't emphasize that enough. And we just finished a cohort where actually we worked with a healing society, the UHQ Healing Society, and the elders first came, and we sat with them at first. So they could learn, we were using ketamine in this case, so they could learn the spirit of ketamine. And once they had met the spirit of ketamine, then we held the healing ceremony for community while the elders were in the room. So it was our team, and woven with the elders, where the elders were singing the prayers, they were playing the rattles, they were using the feathers in service where we all got to work together. So again, I bring this story because it's a model that you can adjust to what you need in your community. When we did our fourth psilocybin group journey for our end-of-life patients, the elders drummed the whole time for us. Makes me want to cry, sorry. In the longhouse, while our people journeyed. So it just really shows you, like, the model, you can work together. And lasting connections. By people coming together in these groups and healing in groups and journeying in the groups, preparing in the groups and integrating in the groups, they actually leave the program with friends. They leave with colleagues. They have people that they can stay in connection with. Many of the groups continue to meet on their own outside of our program. Many of them have gone on vacation together, and many of them come back into the program to journey together and ask if we'll just host their group, and we do. So my bias is being a Canadian, that this should be publicly funded. It should be in the system. This should not be a have and have not situation. We do it in a nonprofit model right now. But we think accessibility, this has to be the top of the pinnacle for access. This cannot be a profit-driven thing. But the cost savings are enormous. So we managed to crunch our data for only depression. It was too complex to look at the population data to put in all the diagnoses people come in. Like, nobody comes in with one diagnosis. But at a minimum, it's a $30,000 savings. So if you don't care about people and you just care about money, this still matters. And firefighters and nurses, we were able to crunch this number very easily. But if you put people back to work healthy, they save your municipalities and your budgets an enormous amount of money. We have a lot of ER nurses. I mean, they're working in war zones day after day. And whenever they start to feel like their resiliency is waning, they get right back into our program, and they're top of their game. We have so many nurses that no longer miss work, are feeling healthy, they're feeling nourished, and they do very well. So we're definitely at a new era. I see I'm out of time, sorry for going long here. We're at a new era in mental health. We need collective healing. We need to get reconnected to ourselves. We need transformative approaches. This is just a model that we hope you take and steal and make it your own. And this is the future. Psychedelics are the future. Anyone that's here that doesn't think they are the future. We need to be bringing them in. There's no right model. There's many models. You'll all figure out your way and how that works, where you live. We need to continue researching. We are a research-driven organization. We have 13 women researchers on our team, and we keep publishing as much as we can, mostly for free off the side of our desks, because it matters. And we want to share our knowledge as much, and we hope you all will share what you're learning too. And this absolutely has to be accessible. We need this more than ever. So thank you very much to the organizers.